Hello, this is Dr. Joe Garri from Mosa Plastic Surgery. Welcome to episode number 13 of the Surgeon's Corner podcast, a series dedicated to patient education on topics related to aesthetic plastic surgery. Our topic of discussion for this episode is a procedure called a neck lift, which is referred to in medical terminology as a cervicoplasty. As we discussed on our previous episode regarding facelifts, it is in the neck area that most of us first notice the changes due to facial aging. Anatomically, the neck extends from the area just below the inferior border of the mandible or lower jaw to the area just superior to the clavicles. It is within the confines of this area where most of us begin to notice the loose skin, increased subcutaneous fat, and blunting of aesthetic anatomical landmarks that herald these unwanted changes related to age. The ideal youthful neck has smooth skin, as well as a sharply demarcated jawline and cervical mental angle. This being the angle between the vertical component of the neck and the tissues under the chin. This angle is created by the vertical muscles of the neck and the horizontal muscles that run in a sling-like configuration under the jaw or the mandible. Some of these muscles insert into a bone that is present in the superior aspect of the neck, called the hyoid bone, which forms the apex of this angle. The tone of the broad muscle that sits just beneath the skin of the neck, called the platysma, is also important in creating the smooth contour and well-defined angles seen in young patients. With aging, the skin of the neck begins to lose its elasticity and develop wrinkling. The muscles and deeper tissues of the neck also loosen with time, leading to blunting of the cervical mental angle and the overall neck laxity seen with aging. When this laxity of the neck tissues becomes severe, the cervical mental angle is totally obliterated, causing the redundant skin of the neck to run straight from the chin to just above the clavicles, a condition commonly referred to as the turkey neck deformity. Furthermore, with the volume changes that are known to take place in the face-neck area as we age, it is not uncommon over time for the neck to develop a certain relative volume increase or fullness, further obliterating the jawline and contributing to the blunting of the cervical mental angle. When patients present with aesthetic complaints regarding their necks, a careful physical examination is necessary to ascertain the underlying issues that pertain to the areas of concern, as there is no single operation that universally applies to all patients. The DEDO classification, spelled D-E-D-O, is a system that was developed to categorize neck deformities or age-related changes based on anatomical components and tissue layers. This system runs from Class 1, which describes the ideal youthful neck, to Class 6, which denotes a low position to the hyoid bone, which makes the neck appear short. The DEDO classification has a significant therapeutic value, as this classification system can be paired with the surgical options best suited for each particular patient. For example, a young patient who complains of neck fullness or slight bulging under the chin, but otherwise has no other issues, classified as a DEDO Class 2, can most times be treated with neck liposuction alone, whereas for some patients who present with more severe deformities or changes related to aging, as in DEDO Class 3 or 4, an open approach to the neck may be indicated. A neck lift or cervicoplasty is a cosmetic surgery procedure that directly addresses the age-related changes of the neck in an attempt to generate a more aesthetic, youthful appearance. Although a facelift surgically addresses both the neck and the face, a neck lift alone is indicated in younger patients who wish to address early signs of facial aging concentrated in the neck area alone, or in patients that are not quite ready to commit to a facelift, even though one might be indicated. If a neck lift is performed on these patients, the second part of the facelift can then be performed as a secondary procedure whenever the patient is ready. Neck lifts are normally performed in an operating room setting, either under general anesthesia or monitored IV sedation. The procedure can take from 2 to 5 hours depending on the severity of the problem or the surgical manipulations being performed, as not all neck lift techniques are the same. As a matter of fact, over the past several years, the operation has evolved from one which involves muscle tightening via sutures with removal of excess skin to one that is more geared towards debulking of the neck, as we will discuss further in the next few minutes. During the prior podcast episode focused on facelifts, I mentioned a subcutaneous muscle of the neck called the platysma, which is used surgically through the placement of strategic sutures to tighten the redundant tissues of the neck in order to create the desired contours. Gaining access to this muscle layer usually involves an incision strategically placed in or close to the crease under the chin, called the submental crease. If significant excess skin is noted, paired incisions are also placed in the posterior aspect of the ear, which then extend inferiorly into the hair-bearing scalp. It is through these incisions, the submental crease and the two posterior incisions, that the skin of the neck is dissected free from the underlying platysmal muscle. The muscle is then sutured together in the midline and posteriorly so as to create a hammock-type effect to tighten the neck and replicate the proper contours. The neck skin is then superimposed on the posterior incisions and the excess skin is removed. After ensuring no active bleeding and washing out the surgical site, the skin is sutured close. At times, drains are indicated due to the extensive undermining necessary for this operation. Over the last several years, there has been a shift in the way surgeons think about some of the age-related changes in the neck and the manipulations needed to best correct those changes. We previously discussed the full heavy neck as being part of the overall volumetric changes that are seen in the neck due to aging. Some of the changes that result in this fullness in the anterior aspect of the neck have to do with 5 anatomical structures that tend to become ptotic or descend over time as the muscle tone of the neck decreases. Those structures are as follows: the single subplatysmal fat deposit located along the midline of the upper neck, as well as the bilateral submandibular salivary glands and the anterior digastric muscles, all of which are located a little bit more lateral. Following, we will briefly discuss these distinct anatomical structures and their relevance. Although most of the fat tissues in the body are located under the skin, thereby being amenable and accessible to liposuction, there are certain areas where the fat is located in deeper tissue pockets, accessible only via open surgery. In one of our prior podcasts, we discussed this phenomenon in terms of the buccal fat pads located in the cheeks. The neck also has one of these areas as a single subplatysmal muscle fat deposit in the middle of the anterior neck, just under the chin and above the hyoid bone. As the platysmal muscle tends to loosen with age, this fat deposit descends into the anterior neck, contributing to the fullness seen in some of these patients. Similarly, the ptosis or descent of the bilateral submandibular salivary glands and bilateral anterior digastric muscles also contribute to the fullness seen in the anterior aspects of the aging neck. Partial resection of these ptotic structures of the neck eliminates the associated fullness or heaviness of the anterior neck, allowing for the recreation of youthful neck shape and contours without the need for undue tension on the platysmal muscle layer. Addressing these subplatysmal structures of the neck is commonly referred to as the deep neck technique. Although not all patients are candidates for these subplatysmal manipulations, this debulking of the anterior neck can lead to spectacular results when indicated and properly performed. A specific variation of the deep neck technique is called a short scar neck lift. It uses the debulking of the anterior neck to redistribute the excess skin, leading to outstanding results without the need for posterior neck incisions or skin resection. In summary, when it comes to technical considerations, we have already discussed how liposuction alone can be of great benefit to younger patients with minimal to moderate neck fullness due to fat tissue in the subcutaneous layer. We have also discussed the traditional neck lift, which involves muscle tightening and skin resection, and the newer techniques that involve debulking of the neck through partial resection of the ptotic or hypertrophic components. Another less used technique indicated particularly in thin males with excessive loose neck skin is the cervicoplasty. This is a type of neck lift that addresses this excess skin by direct excision or removal, placing the incision on the anterior aspect of the neck, and when sutured, results in a scar with a letter Z configuration. Although in most patients undergoing a neck lift, one of the main goals is to hide the scars under the chin and in the posterior scalp, this operation by definition has a prominent anterior neck scar. However, in older males, this scar is subtle and camouflaged in the hair-bearing skin of the anterior neck. For these patients, this less aggressive cervicoplasty and the subtle anterior neck scar it creates offers a favorable risk-benefit ratio of the correction of the severe turkey neck deformity. The potential complication profile of neck lifts is very similar to that of facelifts. Bleeding, leading to a hematoma, as previously described for facelifts, is a potential complications of neck lifts as well. Intraoperative control of bleeding by the surgeon, as well as optimal blood pressure control during and after the surgery, are two measures that are extremely important in the prevention of this complication. The platysma muscle of the neck is considered one of the mimetic muscles of facial expression. Damage to the nerve intervention of this muscle is another potential complication that can lead to lower lip asymmetries, as when talking or smiling, for example. Thankfully, most of these findings are temporary when they do occur and usually completely resolve within 3 to 6 months. In deep neck techniques with partial resection of the submandibular salivary glands, there is the possibility of the formation of sialocele, which is a collection of saliva that leaks from the raw edge of the partially resected gland and collects under the skin. This saliva collection is usually treated by aspiration and the application of pressure to the area, as with the use of a neck garment, for example. A bland diet after a neck lift or facelift is recommended by some surgeons as a way to reduce normal salivary flow and thus minimize the possibility of this complication. Recovery from a neck lift takes 1 to 2 weeks. During that time, it is important to keep the neck extended with the chin pointing superiorly so that the skin attaches to the underlying tissues smoothly. If during the recovery period, the neck is flexed for prolonged periods of time, as while reading a book or looking at a phone or a tablet, for example, the skin is likely to accordion as it adheres to the deeper tissues, leading to skin irregularities that can negatively impact results. Sometimes a neck garment can help with this particular issue, but best is for the patient to be aware of this potential pitfall and make it a point to keep the neck extended as much as possible during the first 2 weeks after surgery. As described above, a neck lift, otherwise known as a cervicoplasty, is a term that describes a cosmetic operation of the neck in order to provide optimal contours and reverse age-related changes. A neck lift can be done as a standalone procedure or as part of a facelift for comprehensive facial rejuvenation. When the technique used is properly paired to address the problems involved, a neck lift can lead to dramatic, long-lasting improvements of deformities and age-related changes of the neck. Thank you very much for your time and attention. This is Dr. Joe Garri. I'll see you in the next episode of the Surgeon's Corner podcast.